I'm David Sanders. I'm from South Africa. I grew up in Zimbabwe, but I live in South Africa. I'm an emeritus professor at the School of Public Health at the University of the Western Cape, which is in Cape Town. And I'm also on the Global Steering Council of the People's Health Movement. The People's Health Movement came out of something called a People's Health Assembly. So we held the first People's Health Assembly in the year 2000. A few of us who've been active in international health, from progressive NGOs and academia and so on, got together in the late 1990s and commiserated about the state of world health and the fact that WHO was a shadow of its former self in prosecuting comprehensive primary health care, which I'll also talk about a bit later. So we actually had this meeting at the World Health Assembly, which is the annual gathering of ministers of health and their senior policy people from all member states, 190 something member states in WHO, and it was an extremely boring experience. And there didn't seem to be any animated discussion about key health policy issues. So someone in our group said, well, why don't we organize a People's Health Assembly? Which we did. So we prepared for about a year and a half and held a People's Health Assembly, so-called, in Bangladesh at a large community NGO in Bangladesh. So it was held on a shoestring. Everyone shared rooms. Local village women provided the food, for which we paid a very small amount. And it was a very animated meeting. And we were very surprised, overwhelmed, in fact, by the number of people who attended, about 1,500 people from over 90 countries. And during the course of the assembly, it was decided that we should actually form a movement, because we couldn't just have another assembly in a few years' time. So we had already drafted a kind of a declaration which became known as, which we call the People's Charter for Health, PCH, which kind of outlines our position. So we started very, very small. We're still pretty small. We had, at that time, no secretariat at all. We've now got a pretty small secretariat, about 6 people, who are spread between Cape Town, Cairo, and Delhi. And we undertake a number of activities to build a progressive social movement on health. So the social movement is founded on the principles which are explained in the People's Charter for Health, but essentially to challenge the forces, structures, systems in the health sector and beyond the health sector which are responsible for continuing and worsening inequality and the fact that there is not health for all. Health for all by the year 2000 was promised. So you can see we waited till December 2000 just in case we reached it and held the People's Health Assembly in December 2000. So we decided, okay, we're going to form a movement which is not going to replace already existing non-governmental organizations, social movements and so on, working in health and health-related areas, but we would try and be a network of networks. And so we've now been in existence for over 12 years. We've had 3 assemblies, and we've built something of a movement. So we have a presence in about 70 countries, where in some countries we're quite active, in others we're quite large, in a few countries like India, where there's undoubtedly PHM India has influenced health policy in India. But in most countries, quite small. But we have a number of organizations affiliated. So, for example, Health Poverty Action is affiliated to PHM. And so the activities we do are all under the umbrella of the right to health and healthcare.